Hi, I'm Naoya Tanabe in Kyoto University in Japan. I'll present data of the paper entitled Computed Tomography Mucus Plugs and Airway Tree Structure in Patients with Chronic Obstructive Pulmonary Disease, Associations with Airflow Limitation, Health-Related Independence, and Mortality. Mucus plugs in the central airways are frequently observed on CT in patients with COPD. Mucus plugs are associated with airway structure and affect airflow limitation and mortality. However, the relative impacts of mucus plugs and underlying airway tree structure on lung function and prognosis are not fully understood. In this study, we examined whether mucus plugs could affect lung function and prognosis in patients with COPD, independent of the underlying airway tree structure. We used data from two Japanese prospective cohorts. In Kyoto Himeji cohort, 199 patients with COPD were included. They underwent CT spirometry and COPD assessment tests, and they were followed up for 3 years to check health-related independence state. In Hokkaido COPD cohort, 96 patients with COPD undergoing inspiratory CT using a single CT scanner were included. They underwent CT spirometry and were followed up for 10 years to check long-term mortality. Mucus plugs were visually assessed for all bronchopulmonary segments, and mucus plug scores were obtained. Moreover, emphysema, wall area percent, WA% in the segmental airways, and total airway count, TAC, visible on CT were measured. The results showed that approximately 30% of patients with COPD had high mucus score in the two cohorts. As shown in figure, high mucus score was associated with higher loss of health-related independence and greater mortality. These associations were observed even after adjustment for emphysema and WA%. Moreover, multivariable models including mucus plugs and TAC were constructed. We found that high mucus plug score and low TAC were independently associated with lower FEV1 in the two cohorts. High mucus score was associated with higher mortality, but not with health-related independence after adjustment for TAC. In contrast, low TAC was associated with higher loss of health-related independence, but not with mortality after adjustment for mucus plug score. In conclusion, mucus plugs and lower airway branch count may have distinct clinical roles in patients with COPD. These CT measures may be useful to identify patients with a greater risk of shorter healthy life expectancy and poor prognosis. Thank you for watching this presentation.